Good evening. Thanks for joining us. Our big story tonight, the daily death toll from COVID in the U.S. is staggering. Yesterday, more than 4,000 people died from the virus. We haven't even reached the post-holiday peak that's expected. And with no cure for COVID, oxygen is one of the main ways that doctors are able to help those with the virus.
Emergency responders in Los Angeles have been ordered to only give oxygen to certain patients in order to conserve it. Team 12's Colleen Sikora is looking to what could happen here in Arizona.
Hospitals in the state tell us they're using up to 4 times the amount of oxygen now than they did pre-COVID. It's a sign of how badly the resource is needed. With all the concerns of the pandemic,
Never even registered as something that we needed to worry about.
Dr. Brandon Lawrence, an ER physician in the West Valley, says oxygen running out did not come to mind until this week when his ER was packed with COVID patients.
Just sitting in triage chairs, didn't even have a bed for them. And they're like, hey, this is our last oxygen tank, like portable oxygen. And so I was like that was not something that was on my radar either in my hospital. And so we were able to scramble and find a whole bunch more.
Lawrence says oxygen is imperative for those with the virus.
It's our main weapon against this disease is just keeping people oxygenated.
An order from Los Angeles County's Emergency Medical Services Agency is now limiting which patients paramedics can give oxygen to. Well, the Army Corps of Engineers has been deployed to fix up hospital oxygen delivery systems in California because of the overload.
There's no reason that if it's happening there, it can't happen here.
Banner Health, which cares for many of the state's COVID patients, tells 12 News their O2 usage is up 30% from last year. And Cobra Valley Medical Center in Globe says they're using up to 4 times the amount of oxygen they normally do. Neither Banner nor Cobra Valley says they're having an issue getting the resource.
It's not a unique LA County problem. It's a national problem.
But Mark Nicotera, CEO of AZ Mediquip, a retail medical supply company in the Valley, says they've been noticing delays since March, saying it's taking several weeks for them to get items in.
The oxygen source itself, be them tanks or concentrators, there's just far more demand than supply.
Lawrence worries about smaller hospitals running out of O2 as the healthcare system continues to be taxed with COVID-19 cases going up in the state.
We have to start rationing care. And that's a really terrifying thought that I doubt anyone that goes in medicine wants to make.
Colleen Sikora, 12 News.